What's wrong? See, all right. This is my garage studio. You like my studio? Hmm. It just keeps growing.
All the necessities back there. All right. Welcome, everybody. Glad to have you back here again on Ask the Expert on News Talk 790 WNIS. I'm Damian Hall and happy to be with you here this hour with Dr. Adam Hogan from Full Implant Choice in Virginia Beach. We're talking about dental implants, teeth in one day, and the amazing life impact that the correct dental situation can bring you. Well, that's what we're talking about this hour, my friends, and always offering consultations at, we'll give you the phone number, the website, everything you need to do and everything you need to know to get in touch with Full Implant Choice throughout this
Did you see me this morning on
expert show. We're also broadcasting on the interwebs as well. But Dr. Hogan, I'm glad to have you here on this Ask the Expert show. How are you feeling this hour? How are you doing?
I'm doing much better now that I'm here with you, Damien, and our special guest. Thanks for having us.
Always a pleasure. Always a pleasure. In the last number of weeks, you've been bringing in special guests here on the show and to tell their experiences. So I'm excited about today's show.
Yeah, I'm excited. I'm really happy to be introducing Miss Debbie. I won't use her full name on the radio, but Miss Deborah, and she's here just to spit out the truth, the gospel truth, as if I'm not even here. I've already told her to say whatever is on her mind.
And he knows I will.
Yeah, I know. She will definitely. Yeah.
Yeah, nice to meet you, Damien.
It's very nice to meet you, Miss Deborah, and I'm glad to have you here for this hour, and I'm excited to hear about your story. And I can already see, and everybody listening right now on the radio can join online. We are broadcasting live on Full Implant Choice's YouTube channel, as well as typically the Facebook channel and a couple other live venues. But at least the YouTube, I believe that we are live, and you can see the video that we're talking about right now. That we're talking. And Deborah, you have a beautiful smile. I just want to say that to begin with. But
Damien, thank you so much.
tell me a little bit about yourself. What and then we'll talk about what got you into Full Implant Choice. But tell me about yourself.
Okay. Well, I have known Dr. Hogan for some years. My mother, Jean Mullis, was a patient with Dr. Hogan and had actually got her implants with his mentor, Truman Baxter. And so then when Dr. Hogan took over the practice after Truman retired, my mom continued to come to him for treatment. So I was having a lot of difficulty, with my teeth. And throughout the years, I had had some dental implants and actually lost one, which they said had got reabsorbed. And so there were just some other things going on within my mouth that I just got to a point where I wanted something permanent, and I wanted to be able to have something that I didn't have to wait 2 to 3 years for. Because typically in my realm of treatment, I was getting all these things from the dentist that I was going to that I needed to get done in order just to start a restorative process, which was going to take maybe 2 to 3 years. And, in the process, you don't have teeth and then you're dealing with the pain. And so my mom was actually the one that encouraged me to see Dr. Hogan. And so I hesitated. I probably took me a little while, and of course I heard the commercials for years with you and Dr. Hogan, and finally I just took the leap and decided to come in and see him. And then still, I would say probably a year, maybe even a year and a half. It was just something you've got to mull over and think about. When's the right time? Is this the right decision? Oh my gosh, am I doing the right thing? And I really just prayed about it. I prayed about it, and it was just something that I really felt that this is between my mom and between um, God, that Dr. Hogan was the answer. And so I kind of finally took the leap, still nervous. I mean, I work in cardiac surgery. I've been in cardiac surgery going into my 39th year. So, I'm very aware of what's going on surgically, and like anybody, even though I do surgery, it's a scary process for anybody, whether it's your mouth, whether it's your feet, whether it's your abdomen, whether it's your heart. And so I was really nervous that, the finality of what few teeth I had, but they were my teeth.
Right. Right.
And then I'm like, oh my gosh, he's going to take my teeth. And then I won't have nothing, which I really didn't have a lot anyway. But, I guess the finality of it. But, once I took the leap and, right away, it's like he said, you leave that day with a smile. And it's like, it's not your permanent, but it's so much better than what you've had, so it was like, this is just wonderful. And I haven't looked back. The whole process has been wonderful. It's been um, virtually, it's so easy. It's so easy. Very little pain. I'll be honest, a couple of days of, getting through, the hurdles of that, but that's typical with any surgery that you have. And really, once I kind of got through 2 or 3 days, I was nothing more than just ibuprofen. And then it was just the process of like, oh my gosh, these look good. And you tell me I'm going to have something better. And now I do. These are my like for real teeth that I will have with me for a long time. What do you think?
Check them out.
What do you
I
think?
know. That's awesome. And everybody listening should check them out themselves. No, they look great. And
Thank you.
check them out
Thank you.
themselves
Thank you.
YouTube right now.
Well, thank you. I appreciate that. And I said on a post last week, it was one of either the reels or something that they had put out on Facebook, and I commented, I was going to the cafeteria last week. I work at Centera Heart, and I had gone over to get my lunch, and I came back, and I'm always talking to people coming down the hallway. I say hi to everyone. And as soon as I said hi to this one girl I was passing, she's like, oh my God, you have such a beautiful smile. And it was like out of nowhere. And it was like, oh my gosh, that's so sweet. And oh my, that was a great feeling.
I love it.
It was
Yeah.
a great feeling. I love
Yeah.
it.
I love it. That's what it's all about. Feel good. Other people notice.
I love it. I love it. Thank you so much.
You're
And
welcome.
it truly is, Damon, and I know you've heard a lot of the stories, the testimonies throughout the years. It really is a life-changing experience. It truly is. And
Hey,
hey, I'm still working at 70, almost 70 in cardiac surgery.
And isn't she looking great?
yeah,
Isn't she looking
Almost
great? Yeah.
70.
absolutely.
Unbelievable.
Yeah, no
So
doubt.
anyway, you want to try to get a word in edgewise?
She's got.
No,
You better go now.
no, absolutely no. Please, you've got the floor. You can continue as long as you would like.
Oh,
You have
well, what kind of
privilege.
questions do you have for me?
Well, just
What would you think the audience would like to hear, or maybe questions they might want answered?
well, I'm always curious about how long people suffer before they get their teeth taken care of, when they know that it's inevitability and they need to have
Mhm.
it done. It's the best decision for them. I feel like some people wait a long time knowing in the back of their head this is what they need to do. I don't know that many people just discover that dental implants are the best option, but tell me about your own situation.
There you go.
Did you know
Yeah.
that dental implants were in the future? How long did you mentioned that you were nervous about it? How long did you wait on the fence, as they say, before finally taking the leap and calling, and making the appointment with Dr. Hogan at Full Implant Choice?
I probably waited maybe about 2 or 3 years before I really kind of made the leap.
Was it just the finality of it all, or like was it more fear of the procedure, or what was it?
No, I don't think it was fear of the procedure, but I think it was the finality of it
Okay.
all, where, people say, I don't know, maybe it's like anything, like, anybody that needs a prosthetic
Right.
device, it's
Right.
like it's not yours. And it's like, oh my gosh, you know, am I going to be one of them people with dentures? And, and
Right.
I helped my mom for years
Right.
up until she passed with hers. And I mean, Truman Baxter did a phenomenal
Amazing
job.
job. Yeah.
Phenomenal
Beautiful
job.
job.
In fact, I think you said she was one of your last. whatever type of implant
It was
that
it was a specialized implant that's not really done anymore. Truman was an international master at it
Yeah,
for sure.
really, really
Yeah.
good. She had been in dentures since she was in her mid 20s.
Right.
So, I mean, basically, she didn't have any bone, hardly anywhere to work with. And this was probably um, the early beginnings of, with technology
Yeah.
and the development of actually giving people something, more permanent than the take in, take out dentures. Now, hers wore take in, take out, but they were really strong and very
Yeah.
sturdy.
But
And
that's what they had to have at the time. Was that late 80s
yes,
that she had that done?
oh,
And she
yeah.
had it until the day she
Yes,
passed.
yes.
2040
So 40 years.
years she had it.
Yeah,
Yeah.
40 years. And was still, I mean, serving her well. Nancy was a hygienist that was
Right.
here for a lot of years.
Yes.
And my mom just loved to see Nancy, knew about her husband, knew everything that was going on. And so she was really part of the whole family here. And maybe a lot of that too with, praying to God about it and knowing my mom had encouraged it. And I'm sorry she didn't get to really live to see
Right.
all of this,
Right.
but she encouraged me to do this, and I'm so glad that I did.
Yeah. Her mom, by the way, was just a special treat in the office every day. I mean, I didn't do her treatment. I just
Right.
managed it, took care of it
Yeah.
afterwards. But most of it was just go in, take a look at Truman's awesome work, and then just chat with your mom. And she was just like Debbie here.
Oh yeah.
Yeah, just very
Yeah.
talkative, very
Yeah.
always smiling.
Yeah. Gift
Yeah.
of gab. Yeah, she really was.
She was. That's where
She
you got
really
it from,
was.
huh?
Yeah.
Yeah.
Yeah. I think so. I think so.
Now, this is probably one of the few patients, Damien, that didn't have trouble probably gabbing before her teeth were done. Probably talked a lot, or did,
No. Oh, and this
yeah.
is it. You'll appreciate this, Damon. So I work in cardiac surgery, right? So when I really kind of, I had lost some back teeth. Well, most of the people you work with and everything, you don't really see the back teeth missing and
No.
things like that. Well, then I had one or two areas that were the front, so now all of a sudden my smile was affected. So I went into work after I'd lost that, and then I'm
The front teeth?
yeah, it was
Yeah.
like the two kind of over
Right.
this way, which was a bridge. And so, it's your smile. And so I went into work and I said, okay, everyone, my family, I've worked with most of them 20 plus years. I said, let's get all the Zuni jokes out of the way right now. Okay. I'm going to get this fixed.
Uh-huh.
And
Right.
started laughing, but they're my family and they all cheered this on and they've kind of lived all of it with me and stuff. But, I work behind a mask and we function a lot like Dr. Hogan here does, in that we're all very close. We just love working with one another, really makes for a great team. And, you're
Amen.
very blessed to have that.
Oh,
And
yeah.
I'm blessed to have
Yeah.
that.
Well, the experience, at your work and at our place of Full Implant Choice, we spend so much of our time at work. We have to be we have to be best friends.
Yes.
We have to trust each other. We
You
have to be
do.
friends.
You do. You
And
do.
I guess
Counselors, sometimes counselors,
all day long,
all of the
counselors.
above,
Yeah.
feeding each other, crying to each other, and probably same thing with you in the studio, doing the same thing. But listen, I know all about, you're down in Moyock or Carolina somewhere, right?
Yeah, just
Yeah,
down
'cause
past the border.
yeah, I hear about all your house stuff going on when
Ju-
you're talking with some of the other guys.
He doesn't mind his friends knowing, just don't tell the government.
All fun.
Right.
That's
He's
all
on.
fun. All fun
It's
and
all
legal,
fun.
at least in Virginia.
Oh,
Or
well,
I'm
this
sorry,
is
at
how
least in
much
North
I know
Carolina.
you. It's funny because you get to, even though I didn't know your face,
Mhm.
I know you through your voice from listening to you a couple of years.
Yeah. Yeah. She's been listening for a long time.
Oh, yeah. I'm a WNIS. My dad would be proud.
Oh, thank you.
I'm a WNIS listener.
Awesome. That's awesome. We absolutely love that. And you remarked about how your relationship with Full Implant Choice and Dr. Hogan and his mentor before with Dr. Truman Baxter, it being a family and you being encouraged by your family and being part of the family there. Tell our listeners a little bit about that family sense. It's hard sometimes to put it into words myself, but I want to hear it from you. Tell me about the atmosphere there that makes Full Implant
Yeah.
Choice different.
Yeah. I think it really, I think from the time that you walk in and that you're met by everyone at the front desk to rotating through, from Nestor and Ashley and Wanda, and I could name so many people. I don't want to leave anybody out, but there's just so many people that are here. The smiles, they make you feel welcome, they make you feel comfortable. You're not rushed into making any kind of decision. They do the scans, they present, here's what we can do for you. Take some time to think about it. We're here. We're here when you're ready. So there's no pushing, there's no pressuring, it's just a bottom line. This is it. This is what we offer. This is what we can do for you. And this is how we can make your life better.
Right.
And then you make that choice because it ultimately is your choice. And, once you make that leap, and it also, I think, too, is that you do hear, like, even, which is really funny, and I won't say his name, but it's a big business, a big dental business here. And my dentist was Gregory Shrub, which I don't mind sharing that. He's retired now. He was a great dentist. But in going for other work, I was referred to a bigger kind of conglomerate type dental practice in the area, right? And I saw someone's father, which I really liked him, and I think he served me well with what I had back at the time with the original 3 implants. Now I think they do 2 in Bridget.
Probably.
But anyway, and he actually had mentioned this years ago, that I might be a candidate for All on Fours, right? Which I'm like, oh, what is that?
Right.
Tell me about that. Well, then he retired, and then when I had some more issues, because I had made that decision that had some more issues, had to go back to him. The son took over the practice. I mean, he immediately, when I said something to him about what his father had recommended, he immediately said, no, I was not a candidate for that.
Just
And
said
so
you said you could not have implants?
could not have
Yeah.
implants. There was not enough bone that would never work for me. And so and that's probably another trigger that made me think about seeing Dr. Hogan, is that all of a sudden I had a controversial, okay, father's telling me one thing, and the son's telling me another. And I kind of really didn't like that discrepancy. And of course, I couldn't go back and get the father to confirm anything because he had since retired.
Right.
And so I think there was a feeling when I came in here and we discussed everything, there was just a feeling of trust. And like I said, I didn't do it right away. It was about a year and a half, past getting my original scan. I think it was about a year and a half
Yeah.
before I really dove in. So there was a lot of thought, a lot of prayer about it.
You were just waiting for the right time for you personally?
That's yes.
I'd like, and I comment on that, if I don't mind, Damien. It's not uncommon at all for people to come in. In fact, my last consult today, probably 3 or 4 p.m. at the end of the day, he had been here almost a year ago, and he's here. I'm ready to go.
Yeah.
So it's never too soon to start the discussion and just find out some information, right?
I agree.
And then find out when is the right time for you.
I agree.
Right.
I agree. My next thing I'm going to do, I don't know if he wants me to say this on the air.
What's up?
But I'm going to see a friend of mine / plastic surgeon for a nice little lift.
Oh.
But
is it our friend?
Our friend.
Our friend.
Our
you can
friend.
say if you want. He's a good
Dr. Ted Urosky.
Urosky's a great doctor.
Ted Urosky and Larry Colin.
Yeah.
Anyway, I'm going to start that process with him. I'll see him the end of this month. And I probably won't do that right away, but I'll get ready and maybe by the fall. So
see, Ted, have your girls call. Debbie's ready.
That's it.
Awesome. Congratulations.
That's right.
Yeah.
Congratulations. Now, we've only got about 2 minutes or so here on our news break, or before our news break here on the radio show here on WNIS with Dr. Adam Hogan with Full Implant Choice. I'll give everybody the phone number in just a second. But Miss Debbie, I don't know, are you leaving here with us apart? Should I ask for parting words before we part for the news break?
You're welcome to do whatever you like. Yeah.
Yes. Anybody listening out there, anybody that can see me on the YouTube, please consider coming to see Dr. Hogan. I don't think you'll be sorry. again, like I said, it's not something that you have to decide on right away. Come, get the consult, get the scans, see what he can do for you, and then take it from there. Pray about it and just make that decision.
Pray
That's
about it.
right. Pray about it.
We got Jesus all over the place. You can have one there. I got one right here.
I'm gonna find this
I'll
guy
use these
for
ones.
some good seafood too. Who was the guy?
That's Wade from Bay Local. He leaves these around, and we got him.
Bay
Yeah.
Local. I'm coming to
Love it.
find you for some good scallops. I hope you're listening.
Yeah.
Those little figurines left around places.
Yes.
He comes
Wait,
in.
Do I get to take one?
Yes, take it with you. Take it with you.
Take one.
Yeah.
Actually, now there's actually another patient that brings them in all the time, so I don't even have to. So I get them, and I get to give them away, and then I get more. Yeah.
I'll go
So
and find Wade and then have him cook me
Pay
some
it
good
forward.
seafood, and then I'll give him a little
that's Wade done at Red Mill Bay Local.
Bay Local.
Yeah, right down at Red
Coming
Mill.
for you.
All right.
Perfect. Well, we're getting ready to go to a real quick break, and we'll be back here on the radio show. We'll take a quick pause, but Dr. Hogan will continue online. Again,
Sure.
everybody listening, make sure you can get in touch, or make sure you call and get your consultation scheduled with Full Implant Choice. Call 757-629-4259. That's 629-4259. FullImplantChoice.com. We'll be back
like
in
this
just a couple
these days.
seconds. It's News Talk 790.
Thanks, Damian. All right, radio is off for a few minutes. Okay. But
love it.
YouTube is still on.
I love
Okay.
it. That
Yeah.
is so nice to see his face too.
Damian,
It was easy peasy.
he's actually a pretty good looking guy.
He's a
you
good
know,
looking guy.
for being in a few fights. You were a fighter and a wrestler, right?
I've been hit in the face a couple of times. We can say that.
Yeah, I could tell. I mean, but not too much.
Yeah. No, the latest broken nose was the dog, and that was just a couple of years ago. So
Oh, I've had that one. The jump up. The
No,
jump
I
up one.
fell- I fell over him. I tripped over him and just caught him right in the top of the nose, and it was right after I had my deviated septum fixed. So I'm kind of back into the
You're kidding me. Mine was the same thing. And this was back in the 80s when I had Dr. Horton did my nose. And right after that, my golden retriever jumped up on my shoulders, but did that nose
yeah.
and I'm like,
Yeah.
Yep.
My nose.
I can't tell you how many people have come in here in an urgency with either babies or dogs that dislodge their front teeth. I mean, every year there's a few.
Oh, yeah.
There's a few for sure.
Yeah.
You gotta be careful.
The head's hard.
Yeah, they don't tell you about that when you're having babies. That the toddlers, when they, oh yeah.
It's hard.
Yeah.
Well, Damien, so nice to finally talk with you, put a face with you.
likewise. But thank you so much. It was a pleasure talking to you, and congratulations on your journeys.
You as well. Thank you. You take care now.
And I want to say for all our YouTube listeners, and I could repeat this on the radio, you've always been a delight. Okay.
You're so sweet.
We try to treat people that we would only call friends, and we hit the mark with you. You know?
That's so true.
yeah.
That is so true.
Thank you so much for that. Thank you.
You are so welcome.
You've always been kind to
Thank you.
my staff and everybody around here, so I appreciate that.
Thank you for changing my life.
You're welcome. Yeah, well, thanks for trusting me and my team, okay?
I do.
Yeah.
Okay.
I'm
I'll
gonna
see you soon.
Okay, we'll talk soon. All right, enjoy your dinner.
Okay.
I'm gonna
Thank
grab
you.
that mic
Thank you
and
so
take
much.
this off you.
Mhm.
And we'll be in
We'll
touch.
be in
soon,
touch.
Okay.
I'll see you in a couple of months.
Perfect.
I think I'm back in about 3 months.
Excuse me, I'm gonna just let her out.
Please, and then we'll be back here for everybody who's, I guess, still joining us back here live on the air in just a couple of minutes. Again,
The back door is wide open.
.com.
Okay, that back door.
Uh-huh.
If you got your stuff. Okay.
Okay. And then
Thank you
to the
so
left, right?
much.
Yeah.
Yeah, to the left outside.
Okay. Sounds
Thank
good.
you so much. Okay. Okay.
That's right. 757-629.
All right.
4259. Yeah. Welcome back, sir.
Yeah, thank you very much. Thank you. Are we back on the air?
No, not yet. I think we got another minute and a half, something like that.
Okay. We're
Yeah.
still on YouTube. I think you're still on YouTube, so you know.
Cool.
Yeah. Debbie, man, she was, we didn't talk about it, but she was watching us on Facebook for 10 years as a regular commenter. And she kept saying in the last few years, I'm going to come in soon. I'm coming in soon. I'm coming in soon. I'm coming in soon. And I'm like, okay, come on. Like when? Come on. You know? So that was kind of a long time coming for her.
I'm going to bring that up.
Yeah, for sure.
Interesting. We didn't get to talk about, this is another topic, but, I'm sure she's aware of the relationship between cardio
Cardio health and dental health.
Yeah, cardiac. Yeah, cardiac health and dental health being,
A-
you know, directly correlated.
Absolutely. Oh no, they go hand in hand.
Yeah.
Yeah, they absolutely go hand in hand. Um, that's no secret. I mean, we've known about that in dentistry for 30, 40 years. I mean, everyone knows that. Respiratory and cardiac health.
Oh,
I had a guy, I'm sorry, you were going to say
we're about
something?
to jump on in, I think,
Okay, go
10,
ahead.
15 seconds. I think Mike's going to give us the countdown here in a second.
Okay, sounds good.
Like he said, I think he's hitting buttons. 4, 3. Okay, here we go. Hold on. All right. Welcome back. Welcome back. Welcome back, everybody. Welcome back, everybody. Welcome back, my friends. Welcome back. I think we're back. It's News Talk 790 WNIS. Well, I'm Damian Hall, and I'm happy to be here this hour with Dr. Adam Hogan from Full Implant Choice, locally owned, locally operated, and focusing on cosmetic dentistry. And in particular, we're talking about teeth in a day and dental implants and the life-changing impacts that has on you, on so many different aspects of your life. And Dr. Hogan's back with us here for the remainder of this hour, leading up until 7 o'clock. So everybody can feel free to join us this hour if you'd like to. 627-7979 is our live phone number to the studios. You can join the conversation if you have a question. But Dr. Hogan, that was a great guest we had on, Miss Deborah, for the first half of the show.
Yeah,
Real sweet person. I mean, that was fun. That was fun.
that's the kind of cardiac nurse she was. She said cardiac nurse, 39 years healthcare. So she kind of knows what it's all about with what we do here at Full Implant Choice. Like she understands the behind the scenes. So having her here talk about her experience as a testimonial is it's a real special thing. I think the public needs to be aware of that because this isn't just a public layperson that doesn't know healthcare coming in. I mean, she understands the ins and outs of patient care, so she really gets it.
Yeah, no doubt about it. And we talked a little bit off of the air. The YouTube watchers might. I want to mention this. You mentioned that you've known Deborah for a long time. She was a fringe listener. She said that she was a radio listener for a long time, and obviously heard
Mhm.
the shows. You mentioned for about a decade or so, she's commented on the YouTube videos. I'm going to come in soon. I'm going to come in soon, and she finally came in, and she just smiles from ear to ear, talking about the impact that it's had on her life. I
Yeah,
imagine there's a lot of people out there with that same phrase. I'm going to come in soon. I'm going
yeah,
to make that call. And now it's 2026. We've been doing this, you know,
yeah,
we might have been doing this 10 years at this point almost. Uh,
yeah.
Getting close
That's
enough
right.
to it for sure. But, and the question for everybody listening is, when is your time then? Is now your time? Was it last year? Was it the year? But was it 2024? That's already 2 years
Yeah,
past us at this point. Uh,
yeah.
tell me about that because it's so quick that somebody's frown can be turned upside down in so many
Hmm.
ways when they finally get off the proverbial fence and make the call to Full Implant Choice. Tell me about how
Right.
that call goes when they meet the staff,
Yeah,
and then we'll talk about how fast they're into a better
yeah.
dental situation.
Yeah. Well, I mean, so many, I mean, it happens fast, but I mean, we'll get there, but to go back, people all the time, all you radio listeners out there, everyone says, one day I'm going to X, Y, and Z. One day I'm going to renovate the backyard. One day I'm going to do this kitchen. One day I'm going to go back to school and get my degree. One day I'm going to go on vacation. And then one day, 5 years later, 8 years later, 10 years later, you haven't been on vacation. You haven't gone back and got your degree. You haven't even painted the fence in the backyard. And, imagine you've wasted 5, 8, 10 years of your life. And the same thing happens with teeth and smiles. They go, one day I'm going to call Full Implant Choice. I'm going to call Adam Hogan. One day I'm going to do it. And then they're listening right now and they're saying in their head, right now, I just caught 75,000 people out there saying, one day I'm going to call Full Implant Choice. And then when this radio show goes off, they think about it for 10 minutes at home and then they don't even catch the show for another 6 months, and then it's another 3 years later and they've lost 3 years of their life. And, I think I'm not going to speak. I think Debbie spoke for herself. It wasn't so much fear. It was just having the right time for her. But for a lot of people out there, it's fear and worry. And they just push it back and they go, oh, well, it's probably going to cost too much. It's probably going to hurt too much. It's probably wrong, wrong, wrong. It's probably going to take 2 years to get done. Wrong. It's going to take a few hours a day. And, they just don't know what they don't know until they come in and get the information. And so, like Debbie, by the time you finally get around to deciding to come in, you get some information. And maybe you're ready to go next week or next month. Like, 3 or 4 people we met today, just ready in the next month. And maybe you're like that guy who came in that was here last June and now he's ready. Or like Debbie, who came in and I think she said in her words, a year and a half later, she was ready, which is fine. And she said there was no pressure, which is interesting because I do consultations for a lot of people, and I do consultations for a lot of people that have been somewhere else. So we call those second consults, third consults. And they always remark that we are pressure free. And they always remark that at the big corporate centers or the other offices and in some family offices, it's you're here, hurry up, give me money, let's get a date. You can't leave until you pick a date. And they talk about the intense pressure at other places. And everybody here talks about how you guys just tell me what you need and then you let me decide. And you don't push me. And we really pride ourselves in that. I mean, I've hired a couple people that have been pushy and I've let them go as fast as I hired them because we're not selling used cars here. You know, it's not that everybody who steps in the lot has to leave with a car or it's a failure. That's not our mantra. That's not our philosophy. But that is the philosophy at some other dental offices, especially those that are run by large corporations that are only looking for the sale. So Debbie talked about it. We've had many, many patients talk about it. And it's just the God honest gospel truth. You know, it's just pressure free. You come in here, you do your consultation, pressure free. When you're ready, pick a date. We're going to have you some teeth in that day, brand new teeth. And Debbie said that her last dentist told her that if she was to get a full new set of teeth with implants, I believe she said here about 20 minutes ago that her last dentist said, no, two things she said. One dentist said, you can't have implants. You don't have enough bone. You saw her here. She has, I think, 10 implants. And then another dentist said, if you do this, it'll take 2 years. Why? Because that dentist believed you had to bone graft and then do all this nonsense and wear dentures for a while, which is one way to do it. I view it as the old way. All right. But she didn't believe. So she had to come here and find out for herself that she can get brand new teeth and she can get 10 implants where 2 doctors said she couldn't have implants. There wasn't enough bone. She got 10 implants and she got new teeth on the same day. Never wore a denture. So it's incredible. And, you know, it's just a miracle given by God that we're able to do this for people. But it's the truth. It's the God's honest truth. We can do it.
Love it. Love it. Fullimplantchoice.com. Log on to the website. You can go to the YouTube channels, all of the social medias, and find out more. See before and after testimonials, videos. We're actually broadcasting live, I believe, at least on YouTube, maybe a couple of the other socials as well. There's so many ways to get in touch with Full Implant Choice. Pick up the phone, call, talk to a live person right here in Hampton Roads, 757 629 4259. Again, 629 4259. And again, I threw out the phone number to the radio station, 627-7979. Feel free to join us. And I believe we have Rick in Virginia Beach with a question on the line. Welcome there, Rick. So glad to have you here this evening. How are you? Hey, Rick, do us a favor. Excuse me, turn down your radio and listen through the phone. How are you this evening? Hey there, Rick. Are you still there? Well, there we go. There we go. Yep, and that's a good word for everybody. Turn down the radio. There you go. How's it going, Rick? How are you doing this evening, my friend? Thank you.
I'm familiar. Yes, I'm familiar. Yeah. Hmm. Hmm. I think it would be a good idea after 9 or 12 months to get reacquainted before we, move forward on anything. But I'm sure it won't be a problem. It's about a 3 or 4 month healing period, but you're leaving with a temporary, but it is fixed in your mouth like real teeth. It's not a denture or a partial denture, and that's the real difference. I don't want to mince any words. You know, I don't want to confuse what the other competitors say, and I want to comment on that later based on a consult I heard earlier. But the teeth you leave with, they're in your mouth. They do not come in and out, and we can give you that in the same day. Yeah. Well, yeah, we take you through the steps in your consultation as well. Make sure you fully understand. But there's about 6 or 7 appointments over about 5 months. Until you get your permanent teeth. But there's various points or days or weeks where we track your progress and make sure you're doing well. All right, we keep a close eye on you. We don't just kind of do the teeth and forget about it. Like some corporate entities, they want to give you final teeth in 3 days and then good luck. I don't even want to take you through all the failures and remakes that they have, but you can look them up online as a matter of public record. But we really track our patients very, very carefully over those 5 months until they get to finals. But rest assured, you have teeth the whole time, and we keep you comfortable the whole time. And so we're very attentive to detail after the fact. It's not just on the front end. Okay. Yes, we're accepting patients. Uh, for anybody that needs a new smile and needs, or dental implants and the missing teeth. But if you're not sure, just come on in for a consultation and we'll discuss it and see what your options are. Rest assured, there have been a lot of people who have come to this office thinking that they're going to get their teeth replaced, and I've told them, no, not now. So if you just want a good, honest opinion of what it looks like, we can go through it.
Yeah.
Yeah, good, good, great. No, I'm not charging you a fee for a consultation. No. So come on in, meet the team, meet the staff, get some time with me, and let's chat about what you need.
Yeah. And like Dr. Hogan said earlier, no pressure, no obligation. It's a free consultation for all of the listeners.
Well, I had a consultation earlier. You were talking about going through this with the other office, and they were going to give you testimonials, but they never could produce them and whatnot. And then, the mincing of the language, the steering of the language by salespeople is a comment I want to make. But one, our testimonials, Google reviews. I don't know what we've got. 1,000 5-star Google reviews. They are just about all from people that have had their teeth replaced or at least had a dental implant. I would say all. I would say probably 80% of them are from people that have had their teeth redone by us. And so that's there. We've got 2 big thank you books in the waiting room full of cards. In fact, we were talking, we haven't saved cards probably in 5 years, and we were talking we should probably make a 3rd and a 4th and a 5th book. We've got that going. Every time you come into my office, there are probably 5 or 8 people in my office who have had the procedure done you can talk to. And then, of course, you got people like Debbie. And I was going to talk about websites and testimonials. Public beware. I know there's one group in the area, at least one, because I've verified it, that all the testimonials on the website of their local office were testimonials that were gathered by the corporation in other parts of the country, not even pertaining to that local doctor. And there's a lot of offices, a lot of websites where they put up pictures of patients that aren't even actual patients. They're just stock photography, or they're another doctor's pictures. Everything you see on our office, it's going to say actual patient. And it's all our results. When you come into our waiting room, there's people, pictures on the wall, and they're in the hallways. And these people, they're all our work. So there's a lot of testimonials out there for us. And I think it's laughable that somebody would say they're too busy to gather testimonials.
Yeah, they're hiding something.
I don't think you're making it up at all. I think you were told that 100%, sir. I believe you. I just think it's funny that they would offer that as an excuse.
Yeah, yeah.
Well, we usually get consults in within a couple of days. Surgery times vary. They're probably, I mean, it could be 4 to 8 weeks. I don't know my own schedule offhand.
Yeah.
Yeah. Thank you very much, Rick.
Yeah. Good luck, Rick. And
Thank
thank
you.
you too. And the same offer goes for all of our listeners. Again, call 757-629-4259. 757-629-4259. We got about
Right.
5 minutes left here on our Ask the Expert show live on WNIS.
Yep.
You were going to mention a nightmare consultation.
Yeah. So, the other consultation we had, gentleman came in, not going to say his name, but this is all too common. This happens quite frequently. I'll try to sum it up, but when you come into full implant choice, you get the whole truth. You know everything that's going to be coming, and you're going to get teeth fixed on implants that don't come in and out of your mouth. Everybody knows that. But there's a lot of places where people go and they sort of get duped. Consultation came in today. He was angry because he met us last year and another office convinced him they were going to do the exact same thing and they were going to do it for half the price. And in fact, this man was so angry there were tears in his eyes. He's been duped and they took his money. And he was told the whole time but that office does exactly what full implant choice does. They just charge half the price. They promised him the teeth wouldn't come out of the mouth. They kept using the word permanent teeth. And then when he finally, it took about 6 months, 8 months to get done. So it's been June. So he just got these teeth in. So it's been over 8 months. And they hand him dentures that snap in on implants. And he said, "What are you doing? You said I was going to get permanent teeth." They said, "No, we didn't. We never said that." He said, "All your salespeople said that. That's what everybody said." The manager says, "No, they wouldn't have said that. We don't do that here." And I hear this all the time. that this happens. People, and what he said, he goes, they use adjacent words. They try to fool you. And it's a fact, and it's a sad tragedy, because I've been seeing this for 20 years, and especially over the last 5 or 7 years, I've been seeing this quite a bit, that people just get duped. And I tell all of our people we meet, if anybody is going to offer it cheaper, they either cutting corners or they're not doing the same thing. Fact. They're not doing the same thing, or they're cutting corners. And we can go through details. I teach this internationally. I teach the business of this internationally. I know all about it. And so when somebody says someone else is going to do it half price, we told them last year, you're not getting the same thing. No, they said I'm getting the same thing. Guess what? Back here 9 months later, hat in hand, apologetically, I got fooled. And we hear it all the time, and it's really quite sad. And I'm sorry if you're out there and you're a dentist or you're a corporate center and this bothers you. It probably should, because it's the truth, and that's all I'm ever going to say. But it's sad what they did to him and what they do to so many people.
Yeah, absolutely. And I was thinking earlier, and I don't have time to elaborate on it, but it's the lowest price it'll ever be, because your dollar is worth less tomorrow, arguably. And
Yeah.
you know, today it's never going to be cheaper than it is today. To have a smile you can be proud of, to look at the mirror every day and be happy of your decision, to have your grandkids see you with that big smile and remember you that way. All the doors that it can open, and the doors you can help close if you'd like to. But we're out of time, Dr. Hogan. We're down to less than a minute. Any quick parting words for our listeners?
Well, I want to thank Debbie for coming on today and, giving her side of the story, all completely unrehearsed, unpaid for testimonials. And really a lot of appreciation for her, and a lot of appreciation for the staff that we have here that make her feel that way. That's really all I got.
Yeah, no, wonderful. A great show. Really appreciate it. And for everybody listening, don't wait. Today is the day. Call right now. Talk to a live person and get that no pressure consultation with full implant choice in Virginia Beach. I'm Damian Hall for News Talk 790 WNIS. Enjoy your evening.
Thanks, Damian. Have a great night.
We'll talk to you soon. Thank you.
Thank you. Have a good night. Talk to you later. I'm going to wrap up on YouTube. All right, guys, everybody out there, finished up this YouTube. Hey, I got a little passionate there at the end when we talked. I was talking about that consultation today. And it's not so much that the dentistry he got, although I do probably have some issues with the dentistry that he got, but it's about a person out there getting lied to and getting deceived, all for the sale. And, that really just boils my blood, and I get kind of animated. I get kind of heated about it, because I don't think anybody should be lied to. If you're a competitor of Full Implant Choice and you want to offer a lesser treatment for a lesser price, fine. Just say it's a lesser treatment. Don't tell people it's the same thing. And then, you get into it 6 months and you're like, and they say, oh, no, we didn't say that. No, we didn't make you feel that they weren't going to come in and out. And the patient goes, no, you did. You told me they'll be in my mouth all the time and they don't come in and out. No, we didn't say it. Then you get into these words. It blows my mind, because here at Full Implant Choice, we give it to you like it is. We give you the truth. We tell you what we're going to do for you. That's what we're going to do for you. We offer you the best treatment. If you can't afford it, we'll tell you some other treatments you can get as well, but where you're at. That they're not the very best treatment. And we don't do what I hear from so many consultations come in here. They say, well, I didn't go with you because the other office was half price, but then we got halfway through the procedure and they wanted more. No, here it's just, this is all the whole price, all of it, all out the door from start to finish, and, there's never like, oh, well, we've only gone this far. If there is a episode like that, it's because it was prearranged and it was all written down and signed for in advance, so we all knew exactly what was coming. But those are just cases where we're just trying to help people get to the next step and get a little more healthy, and help when they can't afford the whole thing. We're just helping them get along, because there are those cases. But no, when you come into Full Implant Choice, you're going to get the best treatment you can have at a fair, honest price, and that's going to be the price. And if you can't afford it, well, we can work down from there, and we can talk about maybe you wait a year or two, maybe you do part of it now, more of it later. But I got a little animated, because I'm a little heated, because this guy was upset. He clearly been lied to. And I've seen it many times, too many times to even counter imagine. And it's just it's sad to say that it goes on out there. So sorry if I got a little heated about it, but I'm just not going to stand for that. But with that being said, on a good note, Debbie came in, gave Debbie's a beautiful person, beautiful soul, inside and out, caring person. I knew her mother, by the way, and her mother was the same way. So I know good family, good stock. But I appreciate everything that she had said on our behalf here at Full Implant Choice, because we really work hard for that and to impress people and give people the very best experience. So thank you, Debbie, for coming in. Thank you to my staff. Thank you to my beautiful wife who keeps the show running. Thank you to my dog who comes in and makes people feel at ease when they need a therapy dog. And that's about it. So until next time, thanks WNIS for starting this off and kicking off and putting it on, and for everyone out there in YouTube. All right, guys, it's been a long day, 7 p.m. I got to go home and got to go see my baby and my wife. All right, we'll see you back in the office tomorrow. We're going to change another life. Take care.